Hello, everyone. I am Camellia Douglas, a psychiatric mental health nurse practitioner, a nurse enthusiast, and coach. And I should add that I'm a mental health enthusiast. I wanted to get on today. I actually haven't done a video in quite some time. And with full transparency, I've actually been really busy. Have accepted a position as adjunct faculty for a local community college, and I'm also doing a lot of telehealth work. And so that's really pulling me in different directions with good reason, for good reason. But I wanted to get on to just share some brief information as I've endeavored to do over the last year as it pertains to the psychiatric mental health nurse practitioner role. And today I want to focus more specifically on questions to ask prior to starting a PMHNP job. Now, this could actually translate to any nurse practitioner job, but I'll hone in a little bit throughout this video as to why very specifically there should be specific questions around certain things as it pertains to mental health. So I'll jump right in. And this video, by the way, is designed for anyone who is considering the PMHNP role. You're a PMHNP student. You are getting ready to take your boards and look for jobs. And it's also for maybe someone who's been practicing as a PMHNP and you are planning to pursue a different position. So just a little bit about me before I get into those questions. I actually have worked mostly outpatient as a psychiatric mental health nurse practitioner. I've been practicing since 2017. I have worked outpatient. I also do some work in the emergency room. I work in behavioral health ED, and I also work in a private practice, and I'm doing some work with both telehealth and outpatient private practice. So just a few different areas. I've done a video before on the different places that you can work. As a PMHNP, it feels like you may be more limited because you have to specify, the type of population that you're working in. But what I will say is that you can actually practice in a lot of different places as a PMHNP. So more to come there. I'll share a little bit more in future videos. But the questions here to ask prior to starting a PMHNP job, and I'm going to be referring to my notes here. I want you to pay attention to these things. Number one is, what does a typical day look like? So patient load is important. Number of patients per day. And this is one of the questions, of course, that can translate as an NP, for an NP if you're working as an FNP or another type of nurse practitioner. But I'll tell you for mental health specifically that this is very, very important because it can be very, very taxing if you are seeing an excessive amount of patients per day. For most people, it's not sustainable. If you consider the nature of mental health visits, you are really getting and should be getting a lot of history, a lot of information from patients. A lot of times they want to talk to you about what's going on with them, and that takes time. And what we find is that, because it takes time, it's really a lot to take on, I would say, more than 15 patients a day. And of course, that's subjective. Everyone can, sort of handle a different thing and handle a different amount. But when you get into that practice, and some of you that have been practicing may already know this, but it can become very, very taxing to see more than 15 to 20 patients. I would say 15 is probably the better number. And mental exhaustion and sort of going through and your day and being able to sustain this type of career, it can be a lot. Okay, so just consider what's a typical day like. Maybe shadow. Patient load, number of patients per day is where you should be asking questions. Number two is, how much time will I have for each patient? So the standard is to have a specific amount of time for a new patient, or what's deemed as an initial visit, and then a standard amount of time that you would have for a follow-up patient. And that, of course, would be considered an established patient. I will tell you that it's different based on where you go, what setting you work in. There are many places, very few, that still offer 60-minute visits or 45-minute visits for initial visits or new patients. There are lots of organizations, just from my interviewing at different places, that only offer 30 minutes. It can be done, but it really, I mean, if you're thinking about getting a really good history, sometimes it does require more time. So a lot of times, what we find is that if you have a 30-minute visit, you may need to schedule another visit with that patient to really get more information before you decide on a treatment plan. But ideally in mental health, now this may work well in a place where you're doing medical, physical health examinations and doing things more along the physical health realm. But when you're considering mental health, when all of what you're doing is building rapport and talking with the patient, you're not doing anything hands-on with patients, it's really ideal to have more time and to have enough time to do that. So if you're looking at different places, 45 minutes, sometimes 60 minutes would be ideal. But of course, as I said, a lot of organizations are moving toward 30-minute visits. And it doesn't mean you can't get it done, again, but it also means that you have to be prepared if you need to get more information before you talk about a treatment plan with a patient. Okay. I've worked in places where I've had both. It is an adjustment. The good thing about, and I'll share this later, is that if you're in something like private practice, you can actually, determine how much time you allot to your patients. But if you're working along organizations, other organizations that are not considered private practice, some of the rules and regulations do require you see, X amount of patients per day. You have a 30-minute slot for a new patient, a 15-minute slot for a follow-up visit. And even, sometimes that's still a lot when you only have 15 minutes. So consider that if you are a person, if you're new and you think you may need more time, you can negotiate there and ask, for the first 6 months, can I at least get 45-minute visits or 60-minute visits to get me going, and then consider scaling back later. That's usually an option. Also, consider how much time is embedded for charting. You have 30 minutes, but how much time do you actually have to chart, on patients? Or if you're a person who charts while patients are in the room, then that's great. But consider, again, on top of needing more time to get more history for an initial visit, maybe a patient is having a challenge with a follow-up visit, maybe they're having side effects to a medication, that requires more time. So also consider that you're also going to need time for charting. You're going to need time to document and to do what's necessary to fully care for the patient. And so, think about those things as you're navigating and sort of looking at different job opportunities. There are some organizations who are really focused in on that, and that will be more flexible there. So question number 3 is, what will your MD supervision look like? Okay. This is state dependent. I am not in an independent state. I'm actually practicing in North Carolina, and I have a pending license in California. But I will tell you that MD supervision is highly, highly important, particularly if you are a new graduate PMHNP. You want to feel that you have that security in being able to ask questions, being able to bounce your ideas or your thoughts about a treatment plan, with a supervising physician. And again, I'm not in an independent state, so I do have to collaborate with the physician. Higher acuity cases, I have to collaborate, at least, a couple times a month, and have that documented, for, the fact that I've collaborated with a supervising physician. But I mentioned that it's important for you to know what that looks like, because, not just having a supervising physician on paper is important. If you feel like you're going to need more support, do ask questions around that. If you are a new nurse practitioner, a new psychiatric nurse practitioner, you want to know that you're going to feel supported when you get into practicing with patients and you have questions. Okay, so there is actually, and we'll talk about this later, but for supervision in North Carolina, we have to show that we've been supervised. There's documentation that we have to complete. The supervising doctor has to sign off on that. And I really think that's a great thing. It's really been helpful here for us to stay within guidelines, but also it helps me to feel more supported. Again, I've been practicing since 2017. I don't feel like I need quite as much support as I did initially, of course. And there's a learning curve that goes with that. And some of that was based in, feeling well prepared from the program that I pursued and the clinical placements that I had while I was in school. However, when I need to address something or have a very specific concern, maybe it's something I haven't seen before. Maybe it's a higher acuity patient. Maybe a patient is not responding well to treatment and they've exhausted most of the treatment options. Those are questions that come up, particularly in mental health, that we need to be able to have that support and that backup. So I do ask that question, is it hands-on supervision? Is it, will I have monthly meetings? Will I have, verbal supervision by phone, or will they be here on campus? Those are questions to ask, okay? And question number 4 is salary questions. What will my salary be based on? So I kind of group this into one particular bucket here, but questions along salary have to do with, as a PMHNP, you are considered a specialty. You are going to be a higher paid nurse practitioner, just given that you are in a specialty. But you also want to know, are you paid based on a contract? You want to read between the lines. You want to know if your salary changes after a certain amount of time. Okay. Are there bonuses? What's the structure for the bonuses? What are the bonuses based on? Sometimes bonuses are based on patient numbers. Sometimes it's based on patient satisfaction. Sometimes it's based on metrics. So, for example, one of the places that I worked before in outpatient, metrics meaning depression scale screenings, patient satisfaction, no-show rates. Those are all factors that are encompassed in what we consider a bonus. And you want to know, is that a part of your baseline pay, or will that be supplemental to your baseline income? Okay, so I will talk more about salary because, again, that's a bucket, but those are some questions that, are very specific to salary that you may want to consider going into a job or going into, questions around salary. Okay, I know that this has been a longer video than I anticipated, but I do want you guys to let me know, what questions do you have? Let me know, if you have other ideas, other comments based on your own experiences around these things. Going into a job as a PMHNP, whether you're new or experienced, these are all questions that I found have been very helpful to ask up front and initially, so that you have no surprises, so that you're not looking for another job, as soon as you get in the door. Okay. But let me know if you have questions. I'm hopeful this was helpful to someone, and I look forward to hearing from you guys soon. Have a good day.